Chapter 1, Introduction to Central Service, Learning Objectives. As a result of successfully completing this chapter, readers will be able to 1. Explain the importance of the Central Service Department with an emphasis on the service provided and the role of Central Service in quality patient care. 2. Review the workflow process in an effectively organized Central Service Department. 3. Identify basic knowledge and skills required for effective Central Service technicians. 4. Define job responsibilities of Central Service technicians. And 5. Discuss the role of education and training in the field of Central Service. Introduction. The majority of medical procedures require the use of supplies, instruments, and/or equipment. Some items are used once and then discarded, while others are reused multiple times. Reusable items must be thoroughly cleaned, inspected, disinfected, and/or sterilized before they can be used to treat other patients. The Central Service Department in a healthcare facility performs these major important reprocessing activities. Advanced technologies. Medical technology is rapidly advancing. The medical devices used in the operating room and throughout the healthcare facility have changed dramatically over the years. As these devices become more complex, the same can be said of the methods required to reprocess them. Like the entire medical field, the CS profession has evolved significantly through the years. The advances experienced in patient treatment and care have come with advances in the medical devices used to provide those services. Today's increasingly sophisticated medical devices require more complex handling and processing, which has resulted in many changes for central sterile technicians. These changes have not happened overnight, but have been introduced steadily throughout the past year. For example, one need only to look back a short time to identify changes that have been enabled, called minimally invasive procedures. These procedures provide many benefits to patients, including shortened stays, smaller incisions, reduced trauma, and shorter recovery times. These procedures require complex instrumentation, and that instrumentation requires complex processing protocols. Medical technologies will continue to advance, devices will become more complex, and Central Service technicians will be required to keep up with advances. This chapter will provide an introduction to the field of Central Service and an overview of the knowledge and skills required to meet the demand for timely, safe, and functional medical devices. Minimally invasive procedures defined. A surgical procedure done in a manner that causes little or no trauma or injury to the patient. It is often performed through a cannula using lasers, endoscopes, or laparoscopes. Compared with other procedures, minimally invasive procedures involve small incisions, less bleeding, smaller amounts of anesthesia, less pain, and minimal scarring. The Central and Central Service. The term central suggests that services are centralized. Processing soiled goods and sterilizing devices so they are ready for the next procedure is typically conducted in one centralized location. Many healthcare facilities find an increased demand for processing services, partially as a result of a growing trend, the use of more reusable and more complex medical devices. In addition, many facilities have expanded to clinics, ambulatory surgery centers, professional offices, and other service venues that may be remote from the facility's main location. In response to this growing demand for processing services, satellite processing units with centralized management have been established. Others have consolidated, centralized services into an entire integrated delivery network, IDN. Other organizations outsource required services to specialized businesses. Regardless of where processing activities are conducted, quality practices must be standardized in compliance with CS policies and procedures to enable standards of practice to be consistent and uniform. Integrated Delivery Network, IDN, a system of healthcare providers and organizations that provides or arranges to provide a coordinated range of services to a specific population. Centralized management helps provide maximum utilization of human and material resources. This eliminates the costly duplication of processing equipment, utilities, space, and personnel. Educated and skilled central sterile technicians must be knowledgeable about the complexities, precautions, and techniques required for their job. They must carry out tasks in a manner that protect the welfare and safety of patients, co-workers, themselves, and their community. Proven material handling techniques are employed to provide high levels of efficiency. When services are centralized, when the most effective processing equipment is used, and when a better educated and prepared workforce is available, staff can process a greater volume of materials in less time. This helps to meet the demands of increased workloads in today's healthcare environment. The service and central service. The term service is the key to what central service is all about. In most cases, the services delivered by central service personnel assist direct patient care providers by providing the items that are essential for proper patient treatment. Other departments, customers within the healthcare facility, depend on central service for processed sterilized supplies, instruments, equipment, and/or ready-to-use products provided by medical suppliers. Central service personnel must remember that they are an integral part of quality patient care. Central service by many names. The title Central Service is the accepted name for this department in many healthcare facilities and professional organizations. In some facilities, the title Central Service is changed to reflect the scope of service or other needs. Not all central service departments provide the same services to their customers. Some departments only provide services to surgery, while others may provide services to many other departments in addition to surgery. No matter how many departments are served, the services provided are always guided by the same principles and standard operation. Common names for the departments include central processing, sterile processing, and distribution, central sterile supply, and surgical supply and processing. Note, the U.S. Department of Labor uses the name medical equipment preparers when discussing this field. Central service workflow. Because the Central Service Department is the central location for delivery of soiled, used medical devices and the distribution of clean and sterile items, proper workflow is important to help ensure safety. Soiled materials must be isolated from their clean counterparts to ensure accessible processing conditions. A one-way flow of materials from the soiled area to the clean processing area and onto sterile storage are required. To facilitate a one-way flow of goods and maintain distinction between soiled and clean work areas, physical barriers or walls are used to segregate the functional areas of central service. These areas include decontamination, preparation and packaging, or prep and pack, sterilization, and sterile storage distribution. Decontamination. The decontamination area is where all soiled instruments and other items are received from user departments. Decontamination is the physical or chemical process that renders an inanimate object, such as a medical device that may be contaminated with harmful microbes, safe for further handling. It involves a thorough cleaning process that may be accomplished with manual and/or mechanical cleaning. Cleaning is the first step in the sterilization process. All items returned to this area are considered contaminated and potentially infectious, and items cannot be considered sterile or high-level disinfected if they are not effectively cleaned. Central sterile technicians must have an in-depth knowledge of the items to be cleaned in this area and must select the appropriate method of decontamination as recommended by the device manufacturers. Medical devices must then be properly sorted, disassembled, and cleaned using the established protocols. Decontamination, defined. To make safe by removing or reducing contamination by infectious organisms or other harmful substances, the reduction of contamination to an acceptable level. Working in the decontamination area requires a thorough knowledge and understanding of microbiology and the decontamination process. Central service staff must be able to identify and clean a wide variety of medical devices. Knowledge about cleaning and disinfecting agents and their proper use is critical. Proper protocols for waste, disposal, transportation of contaminated items, and operation of equipment used in the cleaning process, including washer disinfectors, ultrasonic cleaners, cart washers, steam guns, and specialty washers are also required. Central service technicians working in the decontamination area must be protected by the environment. The physical layout of this area, as well as cleaning equipment used in it, must meet the appropriate standards of governmental agencies and the recommendations of professional organizations. Policies and procedures must be developed and followed to ensure that work practices minimize employee injury and exposure to pathogens. To meet the facilities in the Occupational Safety Health Administration, OSHA, safety requirements, CS technicians must wear special attire called Personal Protective Equipment, PPE. PPE minimizes exposure to bloodborne pathogens and other contaminants. PPE includes fluid-resistant face mask, eye protection, a fluid-resistant covered gown, general-purpose utility gloves, and fluid-resistant shoe covers. Personal Protective Equipment, PPE defined. A part of standard precautions for all healthcare workers to prevent skin and mucous membrane exposure when in contact with blood and body fluid of any patient. PPE includes fluid-resistant protective clothing, disposable gloves, eye protection, face mask, and shoe covers. Preparation and packaging. After items are safe for handling, they are delivered to the prep and pack area of the CS department. Each item is carefully inspected for cleanliness, proper function, and possible defects. Instruments and other devices are assembled, packaged, and labeled in preparation for sterilization. CS technicians must be able to identify hundreds of surgical instruments. They must understand how instruments are manufactured, how they are constructed, how to test them, and how to best maintain them. They must be able to inspect devices for cleanliness, proper condition and function. And it is essential that CS professionals have the knowledge and training to maintain instruments properly, consistently, and safely. Surgical specialty instruments, equipment, and implants also require special knowledge and expertise. CS technicians must be able to select the proper packaging system and use proper techniques for wrapping and packaging items for sterilization. Sterilization. Items to be sterilized must properly be identified, and the correct methods and parameters for sterilization must be followed according to the manufacturer's instructions for use, IFUs. The principles necessary to achieve sterilization must be understood and applied. Sterilizers must be loaded and operated properly, and sterilization quality assurance measures must be followed to help ensure the sterilization parameters have been met. Records must be maintained, and factors that can compromise sterile packaging must be understood, prevented, and detected. Instructions for use, IFUs defined. Information provided by a device manufacturer that provides detailed instructions on how to properly use and process the device. Personnel working in the preparation, package, and sterilization areas of central service must wear facility-restricted attire, such as a scrub suit and hair coverings. It is essential that CS professionals diligently adhere to the dress codes and safe work practices to protect the environment from contamination. Sterile storage and distribution. The supply area of central service is dedicated to the storage of sterile instruments and clean or sterile supplies. A separate area for removing supplies from shipping cartons and containers should be provided. The major portion of the work in this area involves receiving, storing, and dispensing supplies and sterile instruments. While items may be dispensed to almost all departments within the healthcare facility, the major focus of this area is servicing the operating room. This is usually accomplished through the use of case cart systems. The bulk of surgical supplies may be stored in a central location, the CS department, but a dependable system must be in place to supply items to surgery from the sterile storage area. Surgical procedures are usually scheduled through a surgery scheduling office using a special computerized program. When surgical procedures are scheduled, authorized personnel assign a case cart or a doctor's physician's preference card to each procedure. This generates a case cart pull sheet called a pick list that identifies items specific to the doctor and procedure. CS technicians use this sheet to place supplies from the sterile storage area, storage shelves, onto the case carts that transport these items to the appropriate operating room or surgical site. Personnel working in this area usually gather instruments and supplies needed for all scheduled surgical procedures during the day or evening before they will be used. Other areas within the healthcare facility may be supplies from the sterile storage area. Also, hospital personnel from different departments frequently require items that are only available from the central service department. Those working in the sterile storage area must be familiar with all supplies within the location in order to provide fast and accurate customer service. Open lines of communication must be maintained between those in central sterile and sterile storage areas to help ensure that an adequate stock of sterile items is always available. Also, the material management department is an important link in the supply process. Therefore, effective communication and effective problem-solving skills must be fostered between personnel in these two important departments. Personnel working in the sterile storage area must have thorough knowledge of every item, how it is used, where it is located, and the process for obtaining it. Other knowledge and skills include those needed for inventory control and supply distribution, surgical specialties and procedures, sterile storage and handling requirements, computer systems relating to inventory and case carts, acquisition and disposition of supplies, and resolution of supply problems. All CS areas must exercise careful environmental control conditions. Each work area should be restricted to assigned and authorized personnel who consistently follow the facility's dress code policies. Strict traffic control patterns must control the movement of people and goods through the department. Air pressure levels must be maintained to control air movements. Proper air pressure control helps to prevent the flow of bacteria-laden particles and dust from the soil to the clean areas. Definitions of the following terms. Case cart system. An inventory control system for products, equipment typically used in an operating room that involves use of an enclosed or covered cart, generally prepared for one surgical case and not used for general supply replenishment. Case cart. A cart prepared for an individual procedure. Case carts usually contain all instruments, supplies, and utensils needed for a specific procedure. Doctor's or physician's preference card. A document that identifies a physician's needs, requests, and preferences for a specific medical procedure. Preference cards usually contain information regarding the instruments, equipment, supplies, utensils that are used by a specific physician. They may also include reminders for the staff of the physician's preferences regarding patient draping instruments, and supplies. Case cart pull sheet or pick list. A list of specific supplies, utensils, and instruments for a specific procedure. Central service technicians use these lists to assemble the items needed for individual procedures. Finally, Material Management Department. The healthcare department responsible for researching, ordering, receiving, and managing inventory, consumable supplies. The processing cycle. Work performed in the central service usually follows the following processing cycle. After use, items that can be reprocessed are returned to the decontamination area to start the process all over again. It is important to note that at each step in the process, items are inspected to ensure that they are clean, in good repair, assembled, and processed correctly. It is also important to ensure that packaging materials are not damaged, which could compromise sterility. Central service technicians must not only master specific skills in each work area to perform the job, but they must also learn new ones as technologies, regulations and standards, and best practices evolve. The following provides some examples of skills central service technicians may routinely perform. A basic need for educational foundation is needed. Numerous dimensions of knowledge and skills are required for central service technicians to be successful in their jobs. A basic educational foundation is necessary to form the base for more specialized knowledge and skills. Examples of this education foundation include the ability to read and write, including the use of reports, manuals, and instructions for use, communicate with inter and intra-departmental team members, interpret technical materials used for central service practices and procedures, understand concepts of microbial transmission and infection prevention, understand and use surgical and medical terminology, and operate tracking and other central service related computer systems. Basic job knowledge and skills. Central service professionals require significant knowledge and skill sets to perform effectively on the job. Knowledge and skill sets should include the following. Communication skills. Central service technicians must know alternative methods of providing and obtaining information. They must be effective oral and written communication. To do so, they must be able to do the following. Assess the ability of other people to understand what is being communicated. Adapt communication style to individual needs. Apply active listening skills using reflection, restatement, and clarification techniques. Interact appropriately and respectfully with diverse groups in numerous employment situations. Communicate in a straightforward, understandable, accurate, and timely manner. Use facility-specific guidelines and methods to send and receive information. And finally, assess and use electronically produced information. Facility systems. Central service technicians must understand how their role fits into their department, their organization, and the overall healthcare environment. They must be able to identify how key systems affect the services they perform and the quality of care they provide. To do so requires that they do the following. Are aware of the range of services offered to customers, prevent unnecessary waste and duplication, participate in quality improvement activities, use resources including other staff members, manuals, and training opportunities. Employability skills. Successful central sterile technicians practice employability skills to enhance their employment opportunities and job satisfaction, and they maintain and upgrade those skills as required. Examples include the following. Maintaining appropriate personnel skills, such as attendance and time management, and assume individual responsibility for their actions. Maintaining professional conduct standards, using analytical skills to solve problems and make decisions, formulating solutions to problems using critical thinking skills, analyze, synthesize, and evaluate independently and in teams, adapting to changing situations, practice personal integrity and honesty, engage in continuous self-assessment and goal modification for their personal and professional involvement, exhibit respectful and empathetic behavior as they interact with peers, superiors, subordinates, and customers in one-on-one and group situations, listen attentively to verbal instructions, requests, and other information to verify accuracy, and finally, understand various career options and the preparation required for them. Legal responsibilities. Central service technicians must understand and maintain an awareness of the legal responsibilities and limitations and the implications of their actions within the healthcare delivery setting. To do so, they must do the following: solve problems relating to legal dilemmas or issues, comply with established risk management factors and procedures, determine when an incident must be reported, maintain confidentiality, operate within the required scope of practice, follow mandated standards for workplace safety, apply mandated standards for harassment, labor, and other employment laws, and finally, comply with legal requirements for documentation. Ethics. Ethics relates to knowledge, knowing the difference between right and wrong. In the healthcare environment, it means conforming to accepted and professional standards of conduct. Ethical behavior is doing the right thing in the right way. Ethics should govern and guide the way central service technicians act and make decisions. They must always do the following: respect patient rights, promote justice and equal treatment of all individuals, recognize the importance of the patient's needs over other considerations, exhibit loyalty to fellow workers in the healthcare facility, report any activity that adversely affects the health, safety, or welfare of patients, visitors, or fellow workers. Comply at all times with pertinent regulatory guidelines, facility policies, departmental policies, and procedures. Respect interdisciplinary differences among team members. Differentiate between ethical and legal issues. And finally, demonstrate professionalism when interacting with coworkers and customers. Safety practices. Successful central service technicians understand existing and potential hazards to patients, coworkers, and themselves. They prevent injury or illness through safe work practices, and they consistently follow health and safety policies and procedures. They do so as they practice infection control procedures, use standard precautions to control the spread of infection, practice appropriate cleaning, disinfecting, and sterilizing processes, apply principles of body mechanics, including the use of proper lifting techniques, recognizing correct fire and electrical hazards, use equipment as directed, manage hazardous materials, use safety data sheets, SDS, follow emergency procedures and protocols, and finally, comply with pertinent regulatory guidelines, including Osha standards. Standard precautions defined. Method of using appropriate barriers to reduce the risk of transmission of bloodborne or other pathogens from both recognized and unrecognized sources. It is the basic level of infection control to prevent transmission of infectious organisms from contact with blood and all other body fluids to non-intact skin and mucous membranes. This standard applies to all patients, regardless of diagnosis or presumed infectious status. Teamwork. CS technicians must understand the role and responsibility of individual members as a part of the healthcare team, including their ability to promote the delivery of quality healthcare. They must interact effectively and sensitively with all members of their team and do so when they practice team membership skills such as cooperation, leadership, and anticipation of their coworkers' needs, respect diversity within their team, interact with others in a manner consistent with healthcare team structure and lines of authority, manage conflict within the workplace by considering the points of view of others, respect and value the expertise and contributions of all team members, and finally, accept compromises necessary to ensure the best outcomes. Resource management. Central service technicians must understand and practice principles and techniques of research management. Central service technicians manage resources effectively when they control costs and reduce waste, provide quality service, practice time management skills, identify and solve potential problems and anticipate customer needs, know and use inventory appropriately, and practice recycling and sustainability whenever possible. Other skills. Other skills are also required by central service technicians. For example, they must practice prescribed techniques to prevent healthcare-associated infections, HAIs. Keep department work areas in good repair. Keep their work environment clean and organized. New healthcare roles demand higher level of skill than ever before for those working in central service. The complexities created by technology continue to grow, and a new breed of healthcare professional is emerging. Healthcare-associated infection, HAIs defined. An infection that is not present when a patient is admitted to a hospital or healthcare facility. If the infection develops in a patient on or after day 3 of admission to the hospital or healthcare facility, the infection is referred to as a hospital-acquired or healthcare-associated infection. Basic job responsibilities. Central service technicians are accountable for many tasks. Job descriptions are used to define and communicate job duties and requirements to employees within an organization. They are intended to be overviews that capture the general purpose and major accountabilities of a job, and they are used for the following reasons. To evaluate positions and determine compensation. They can be used in conjunction with other resources too, to establish pay range and give a promotion. To clarify expectations, job descriptions outline key job duties which can be reviewed at the time of hire to clarify performance standards and expectations. They should be reviewed regularly, usually annually, by both the supervisor and those who occupy the position, the employee. Also, to review job performance, job descriptions can be used during annual performance reviews. To recognize exceptional performance, restate performance expectations, determine growth opportunities, and establish goals. Because central service departments vary in size and scope of service, and because jobs within the central service department vary, there is no single job description that applies to all situations. When seeking a new job position, it is important to review the job description to determine if the duties and expectations are a fit for your skills and abilities. Job description defined. A human resources tool that identifies the major tasks performed by individuals in specific positions. Career growth and professional development. Many CS departments still use on-the-job training to fulfill job demands. However, a CS technician has developed more fully into a profession. Formal education and certification of a CS technician is frequently becoming a requirement for working in this department. Some states require a certification to work in central service, and many healthcare facilities require it as a condition of employment. Formal central service technology training courses are becoming readily available through post-secondary education systems. Many healthcare systems are developing their own training courses for teaching central service technology. Long-distance learning courses are also available for those who do not have an organized training course readily available in their area. Career growth and professional development opportunities for central service professionals typically depend on their individual motivation to achieve departmental and personal goals. Many facilities offer career progression with more work responsibilities and higher compensation levels within the role of a central service technician. As knowledge and responsibilities increase, a qualified and high-performing technician can advance. Certification defined. Association or industry recognition attained by individuals with education and/or work experience requirements who successfully complete an examination process demonstrating their knowledge of pertinent job-related subject matter. Education and experience are critical. To survive in today's dynamic and complex environment, it is necessary to be prepared. and education and experience become absolutely critical to do so. Qualified and educated professionals are in demand to meet the new challenges of central service departments. Upward mobility to supervisory and management positions require experience and educational skills. Compensation. Compensation, including benefits, is influenced by many factors such as job descriptions, scope and span of responsibility, size of the facility, organizational structure, job market, and geographic location. At the department head level, the central service director should be fairly compensated relative to organizational peers. As previously mentioned, there are a growing number of healthcare facilities that compensate central service staff members with pay increments based on experience, high performance, additional education and training, and upon certification. Conclusion. The central service environment is a dynamic and fast-paced environment. The work is challenging, highly technical, and complex. The performance of this vital department has a major impact on the successful operation of the many departments to which it provides products and services. Inefficiencies in productivity, errors that create the need for rework, and poor quality of performance are costly to hospitals. With the ever-increasing cost of healthcare, central service professionals must conserve resources and minimize expenses. More important is the safety and welfare of patients who have entrusted the facility with their care. Negligence and carelessness in central service could cost a patient their life. Central service is an evolving occupational discipline. Over the years, there have been dynamic changes ranging from the increased use of technology and support service provided to the job skills, training, and educational requirements. And these skills are needed to fulfill these job responsibilities. Changes continue at a rapid scope. Conscientious central sterile professionals will find great satisfaction in knowing their efforts, service, special skills, and due diligence are a part of every surgical procedure and every patient's recovery and every positive outcome. Terms to remember. Minimally invasive surgery, MIS. Integrated delivery network, IDN. Decontamination. Personal protective equipment, PPE. Instructions for use, IFU. Case cart system, case cart. Doctor's, physician's preference card. Case cart pull sheet or pick list. Material Management Department. Standard Precautions. Healthcare Associated Infection, HAI. Job description and certification.